for convening such a really important and really dynamic hearing where we're getting some tremendous information that's going to really, I believe, inform this our committee on how to support higher education and young people in enrollment in community college. This is a question specifically for Dr. Susan Johnson, but for all of the panelists. I've just learned for my district, the University of the Virgin Islands, which is the only higher education institution in the Virgin Islands, in my district, has implemented a COVID-19 vaccine requirement for all students, faculty, and staff. I learned that over 360 public and private colleges are requiring vaccination prior to enrollment, with that number of institutions growing every day. As colleges are returning to in-class instruction, how has vaccination requirements affected enrollment for the fall semester? And how is the administration enforcing and supporting and confirming this compliance at this time?
Thank you for that question. As I was listening to you, I was thinking of my own service as a member of the Board of Trustees of two different colleges, a public and a private, and these are topics that have come before us for conversation. It is a great concern that students be safe and healthy, that faculty and staff be safe and healthy, and yet there is some political discussion behind the requirement. And so that's why you see the numbers that you see. Around 400 are requiring, and the rest have yet to make up their minds, or they have made up their minds. They're not falling into that category. It does make this a challenging environment to lead an institution when you hear from parents, if you have this requirement, I will not send my daughter. And if you have this requirement, and if you don't have this requirement, I won't send my daughter. So damned if you do and damned if you don't in a lot of cases. The highest order of business is to make sure students are safe. And I think that the leadership that institutions show by finding a way to ensure that safety, whether it is continuing the testing over time as students come back. If there is no COVID requirement, then continue the testing. That continues rather high cost for an institution. However, we knew during the pandemic that institutions were spending lots and lots of money on the safety measures that they had to put in place. So it is a complicated question that each institution is weighing, but I think regardless of the answer, the heart of the matter is the safety of the students and the other people who work on the campus, and finding a way to manage the cost associated with continued testing versus the health issues.
Vaccination requirements, especially for students in regions with limited vaccine supplies. That's also a question that I have.
Requiring the vaccination in areas where there are no easy ways to get the vaccination seems problematic. I know a lot of colleges are using their facilities, their connections, and their own resources and government resources to make sure that they get access to the required vaccinations. I think another problem with this is making sure that we're not on emergency approval for some of the vaccinations. That has been a problem for some institutions and some students and parents.
Yes, Mr. Chairman, I've heard that repeatedly in my own community as a rationale, be it right or wrong, as to why people are not getting the vaccine. So to push FDA to get to the place where this is no longer just an emergency approval, I think would go a long way in dispelling some of the myths and notions and conspiracy theories that are out there. Thank you very much for the opportunity to question the panelists. Thank you to the panelists for their time, and I yield back.
Congresswoman Plunkett, thank you for your participation today.